right, we are back and we are joined by Dr. Cynthia Snyder, Infection Prevention Medical Director with Cone Health. She's answering your questions about the current state of COVID-19, the road ahead, and anything else you can think of when it comes to like respiratory illnesses, especially this time of year. It seems to be a mishmash. All right, this person is asking, is it usual for a family to be infected with COVID 3 or 4 times? Oof.
Yeah, it really depends on how adherent folks may have been with wearing a mask, social distancing. So it's not unheard of people having recurrence of COVID illness. And then there's still a few folks, I think anywhere from like 15% of the population that still have never had COVID. So the key thing though is really, we still want people to be vaccinated. If you are out and about, making sure if you're going to be in large gatherings that there's good airflow, wearing a mask to protect yourself from getting infected, or if you have symptoms, make sure you're masking to ensure that you're not exposing others.
Yeah, someone had just asked, is social distancing and masking done? But you kind of just answered the question. If you're going to be in a close, tight room, you might want to be thinking about that again.
Yeah, especially with travel, you know, be it subways, buses, trains, like carpooling, you know, unless you know what everyone else's, how they're doing symptom-wise, you know, the mask does wonders. A well-fitting mask, either like a KN95 or N95 or a KF94, something that's you know, very well-fitting and has good filtration.
All right, this person's asking, my adult son had COVID-19 a year ago and was told that he had immunity and that he didn't need to get his vaccine. Is this true?
So in the beginning, and natural, and what we know about vaccines and immunity in general, it's true that once you have natural immunity from an illness, it usually protects you for a bit of time. However, the SARS-CoV-2 strain has mutated. And so the immunity that you gained from that initial infection may not work to protect you again. So it is still important, even if you've had the infection, to still get a booster.
Or the vaccine, period. Just because you
Correct.
got COVID-19 once doesn't mean you're not going to get it another time, because we just had a question about, is it normal for a family to get it 3 or 4 times? And there are families who have gotten it 3 or 4 times. I mean, it's not something that you get it once and you're not going to ever get it again.
Correct. I think it's just, it is a very, you know, it is a cold virus, right? So we know that you can get multiple colds. And what we do know, there have been studies of folks who had illness and have natural immunity, and subsequently their immune system gets boosted by the vaccine, you know, pulse. And then that helps overall with having higher antibody titers and protecting yourself against severe disease.
All right, this text question says, I have an autoimmune liver condition. Should I get the booster shot and will it be effective?
You know, with immune compromised patients, be it if you have on medication that decreases your immune system, or you have had cancer treatments, all this we know can affect your immune system. It's important to talk to your physician if you're a good candidate to get the vaccine series. I would suspect they would encourage you to get the vaccine series. And then especially if you end up having COVID, it's important to seek care and see if you would be a candidate to receiving some antiviral therapy.
All right, this next text question says, I had COVID on December 24th. It was mild with a sore throat and a mild cold, but I still have some fatigue. How long will this fatigue last?
You know, it's not unheard of folks having fatigue after even a mild disease of COVID illness. And so some people feel under the weather for about 4 to 6 weeks. And then there are those who may feel into the category of having, you know, like what I think in layman's term is considered like long COVID, and that is when it really disrupts, you know, your life, and people feel like they have symptoms that affect like their quality of life, they are unable to work, and that's also another reason to get the vaccine series. We know that if you get vaccinated, your chances of having long COVID decreases.
This person says, my last shot was in September. When do I need to get another one? So that was 4 months ago.
Yes, if you did not receive the bivalent vaccine yet, booster series, you can get it after 2 months from your last vaccine.
Okay. All right. So I believe we're going to take a quick break, and we're going to be back with one last segment of questions. So you still have a little bit of time to get your question in. Again, 336-379-5775.